Okay, so we're going to get started. I am Shirley Kessel, and I'm the Executive Director at Miles for Migraine, and I want to welcome you here this evening. We are really interested to, and I know you're all interested to hear about this topic this evening, because probably a lot of us know that there is a second brain and it resides in the gut, but many of us don't quite understand what that means. So we're going to learn about that this evening. Before we get started, I just want to take a moment to thank our very generous sponsor, which is Impel Pharmaceuticals. I don't know what this is showing on my screen, but it probably may not look as good as it could. So without their generous sponsorship, we could not have this excellent presentation come to you this evening. So thank you to Impel Pharmaceuticals. And I want to now move on quickly because I'm sure you all have questions. So just a few things. This is a webinar, and so there is no chat. The chat is disabled, but you can ask questions. There is a question and answer icon on the screen. It should say Q&A, and you can go in and put your questions in at any time. So we'll try to get through as many questions as we can this evening. And I just want to also share with you that Miles for Migraine, we're mostly known for putting on walk, run, relax events, but we also have a host of other programs that we want to share with you. And if you go to our website, you will see that we have education events such as this one. We also have smaller education events in some of our host race cities. We have support groups, and we have a very interesting program called Act Now, which is the Advocacy Connection Team fellow and patient training to learn more about advocacy. And you might be saying, well, why do I need to learn about advocacy? And the reason is because migraine is, as you know, a stigmatized disease. It is underfunded, it is under-researched relative to the burden that migraine causes. Many of us are left trying to fend for ourselves, and it shouldn't have to be that way. Migraine is also, and other headache disorders, are a newer disease state that have come to the advocacy arena. And that's why it's important for all of us to understand that advocacy needs to be part of your treatment plan. And so if your healthcare provider is not prescribing advocacy for you, then come to Miles for Migraine, learn about all of our programs, and every action that you do counts in terms of advocacy. Maybe you'll even post about this event on your social media pages once it's over, or anything else that Miles for Migraine is running. If you can share our events, it's an act of advocacy, and we all need to learn about the best care, the best management of our disease. Our healthcare providers really don't have enough time to spend with us because, you know, migraine and other headache disorders is complicated. And as good as a headache specialist might be, you know, we are all limited with how much time we have to spend with them. So without further ado, I want to introduce you to, I want to tell you a little bit about Dr. Silberstein, because I've had the pleasure of knowing him now for, I guess 10 years. I'm originally from Philadelphia, where Dr. Silberstein is a professor of neurology and director of the Jefferson Headache Center at Thomas Jefferson University here in Philadelphia. He is involved with migraine research and clinical trials and the author of over 400 peer-reviewed publications. Dr. Silberstein is a fellow of the American College of Physicians, the American Academy of Neurology, and the American Headache Society. Dr. Silberstein served as the AHS president, treasurer, and board of directors member. He is the 2016 Lifetime Achievement Award recipient by American Headache Society. He is chairman within the World Federation of Neurology and president of the Philadelphia Headache Society. He also is the senior editor of the 8th edition and the upcoming 9th edition of Wolf's Headache and Other Head Pain, associate editor of Cephalgia and CNS Drugs, and a present and prior member of the editorial board of Headache, Cephalgia, and Acta Neurologica Scandinavia, Journal of Neurology, Neurosurgery and Psychology, and Topics in Pain. So, Dr. Silberstein, you have a tall order to fill here this evening. There are a lot of people here that want to hear from you. So why don't you go ahead and share your screen and we'll get started. And while he's doing that, just as a reminder that we will take your questions in the Q&A, which can be found at the bottom of your screen, and go ahead and put those questions in at any time. And we will be answering questions once Dr. Silberstein finishes his presentation.
Thank you, Shirley. I'm going to be talking today about migraine, the gut, and the brain. What's the brain? We all have it. We can't live without it. If you look at these pictures, you can see the cerebral cortex and the cerebellum. And basically, it's a highly convoluted structure. It's our computer. Interesting facts. I didn't realize until recently that the sperm whales have the largest brain, weighing 17 pounds, and the human brain only weighs about 3 pounds. The Neanderthal brain, 10% larger than ours. Although the brain is only 2% of our body weight, it uses 20% of the energy. Most of it's water. The brain tissue, the size of a grain of sand, contains 100,000 neurons and 1 billion synapses. Each neuron can transmit 1,000 nerve impulses per second, and supercomputers can only achieve a small fraction of what the human brain does. What about the gut? From the esophagus to the anus, 30 feet long. It has its own nervous system, the second brain. When the vagus nerve is cut, it continues to operate. 90% of the vagus nerve input is from the gut to the brain. 95% of the serotonin and 50% of the dopamine of the body is in the gut. And the gut microbes can help us digest food that we cannot. Here's a way to look at it. Let's look at the brain. It's like a computer in the cloud. Let's look at the gut, the second brain. That's our laptop. The internet is our vagus and our sympathetics. So we have communication between the cloud, or the first brain, and the gut, our second brain, by the vagus nerve and the sympathetics. A little bit more complicated, but let me just point this out to you. In the gut itself, there are neurons. But in addition to that, we have these sympathetic neurons, which have ganglia outside the gut. We have vagal neurons, which also have ganglia outside the gut. And also, we have these intrinsic neurons, which are right here in the gut itself. So again, this is our portable computer. This is our cloud computer. This is our internet connecting them. Interesting. Bowel pain and discomfort, like bloating and urgency, sympathetic nerves give that information. The nutrient composition and the gastric volume are sent to the brain by the vagus nerve, and this can result in not being able to eat, early satiety and nausea. And vagal afferent sends microbe-associated molecular patterns. Why is that important? It keeps track of the GI microenvironment to make sure there aren't bad bugs there. Now let's look at intestinal bacteria. It contributes to the regulation of gut motility and mood. The gut microbiome container and pathways to the brain is called the gut connectome. It communicates with the brain through nerves, hormones, and immune signaling. And the CNS can impact the microbiota by stress mediators, sympathetic and parasympathetic control of GI motility, secretion, and immunity. Extraordinarily complicated system. The bacteria in the gut are part of us. I'm just bringing up this one picture, which is very new, just came out in Science. A certain species of bacteria can actually go into the gut and downregulate immune cells. If that is missing, we get inflammation of the gut and colitis. So now we're talking about something different. The right bacteria can help us. The wrong bacteria can produce inflammation. So we have the gut-brain axis. We have the brain communicating with the gut, and the gut communicating with the bacteria. The bacteria can influence brain behavior, and the brain can actually influence the intestinal microbiota. Okay, let's take a break. Headache treatment depends on making an accurate diagnosis, making sure nothing else is going on, ordering the right studies, which is often nothing, addressing the headache impact. Although the ultimate goal is headache relief, patients want to know what's wrong with them and that they're being taken seriously. There are two types of headache treatment: acute, when you have an attack to make it go away and stop getting worse, or prophylactic preventative, which is taken to reduce attack frequency, severity, and duration. What are the general principles of treatment? Treat early. Earlier the better. You get a better result. Always use non-pharmacologic treatment. Rest, avoid loud noises, cold compresses. And acute medicine should always be used and try to match the treatment to the attack severity. Now, one of the things we need to think about are comorbidities. That's a disorder that's more common in migraine than in a person without migraine. That includes stroke and angina, Raynaud's disease, mitral valve prolapse. Bipolar and depression are much more common, panic disorder. Epilepsy, Bell's palsy, fibromyalgia, vertigo, all of these are more common. And GI, and I'm going to get into that, irritable bowel, peptic ulcer, and I'm going to talk about more of those analogies. So I'm going to be spending my time talking about the GI comorbidities of migraine. GI symptoms complicate migraine and its treatment. Nausea affects up to 90% of people with migraine. Vomiting occurs at some time in half. 1/3 of people with migraine with nausea cannot take oral medicines. The efficacy of oral medicine lost if you have vomit. And if you get gastric stasis and delayed absorption, they don't work very well. So, what are some of the disorders that are associated with migraine? And I'll go through some of these. Gastroparesis, Helicobacter infection, irritable bowel syndrome, inflammatory bowel disease, celiac disease, cyclic vomiting, and abdominal migraine. What's gastroparesis? It's chronic. It's a disorder of the inability of the stomach to empty without evidence of mechanical obstruction. These patients have nausea, vomiting, early satiety. And many patients with migraine have gastroparesis during and possibly between attacks. What that means is if gastroparesis is present, oral medicines are not likely to work. Functional dyspepsia. It's got the symptoms of gastroparesis, but people do not have delayed emptying of the bowel. So you have, of the stomach rather. So therefore, it's similar. And the only way to do it is to do an emptying test of the stomach. Irritable bowel syndrome. It's a chronic disorder. It could either be diarrhea or constipation. It's multiple subtypes depending on what the stool pattern is. And it's 2 to 3 times more common among those with migraine. So if somebody has all these bowel symptoms, it's one of the comorbid disorders that you see with migraine. Abdominal migraine. These are attacks of moderate to severe belly pain without headache, interspersed by symptom-free periods. 2 to 4% of children have it, often around 7 years of age, more in women than men. And these people often get migraine in later life. And there are patients who are adults, and this has been published, that do have abdominal migraine. So this is called quote unquote functional bowel disease. What's that mean? It's probably a disorder of the nerves and the communication, but it doesn't mean it's not real. Now let's talk a bit about triggers. Hunger, fasting, alcohol, certain foods may trigger migraine. It's controversial whether a food allergy can trigger migraine or elimination diets can relieve it. The most common cause of food allergy is food aversion. You think it's going to give you a headache and you stop taking it. Common food triggers, lactose deficiency. It's a common genetic disorder. Symptoms are abdominal cramps, flatulence, and headache, and people can either take a lactate pill to digest it or lactose-free milk. Interesting study, red wine. Those who believed that red wine and not alcohol gave them a headache were given red wine or vodka under controlled substances. The red wine triggered migraine in 9 out of 11. Vodka didn't. No headache in other migraine subjects or controls. And the conclusion was that alcohol might trigger migraine in patients. And if you believe it's red wine, and one of the funny stories that people tell, in England, red wine triggers a headache. In France, it's a white wine. And we always say it's bad wine that triggers the headache. More, monosodium glutamate. That's responsible for the Chinese restaurant syndrome. Produces the migraine-like headache. Chocolate's controversial. Patients with migraine who believe that triggered their migraine were challenged with chocolate. There was no difference between chocolate and the placebo. Chocolate on its own rarely triggers migraine. People get a desire to eat chocolate, the premonitory symptom for migraine, and some of them will get the migraine anyway, and they'll blame the migraine on the chocolate. But in fact, the migraine made them eat the chocolate. I always tell people, keep a chocolate bar handy if you get a migraine attack. The other thing that's important to think about are probiotics. They're the review of probiotics and the frequency and severity of migraine. And basically, what they found is there's no difference. But this is what you need to understand. It's like saying that somebody has an infection, you gave them penicillin, and it didn't work because the bug wasn't responsive to penicillin. Probiotics are a mixture. And how do we know that the person that's getting a probiotic has the right mixture? So until we find out what the right mixture is, what we really need to say is the over-the-counter probiotics probably don't work, but the real ones could. Other interesting thing, artificial sweeteners. They can change the bacteria in the gut. And if it's consumed for as little as 2 weeks, it can affect bacterial communities, which may actually make it more difficult to regulate blood glucose. So you got to be careful with these things. Now, the next thing I want to talk about is telling you all these things that can happen with the gut. Let me talk a bit about routes of drug administration. The most common is oral, convenient and invasive, usually good absorption, but slow absorption. Some of the drugs are irritable and unpalatable. Some drugs are destroyed. First pass effect, what does that mean? Gets in the stomach, goes to the liver and chopped up. And there can be food-drug and drug-drug interactions. So what are the alternatives? Nasal delivery systems. It's easy, convenient self-administration, rapid absorption and onset, doesn't go to the liver, no GI or irritation, a large nasal mucosa area for dose absorption. The degradation of the drug in the gut is avoided, and the bioavailability of large molecules can be increased by absorption enhancers. And this is the new modern alternate to parenteral route. I just want to show you something. The traditional nasal punches on the left, and they deliver the drug to the lower nasal passageway, from which the absorption is quite low. There's a new pod technology on the right, which actually delivers it to the upper nasal passageway, where you get much better absorption. So there are new techniques and pods where using the nasal technology, and also by going to the upper nasal pathway, we don't get it in the throat, and we don't have those same side effects. I think that's it, and I'm open to any and all questions.
Okay, thank you, Dr. Silberstein. We do have some questions. So I'm going to start with a question here that says, if I'm not too nauseated to eat, my migraine pain eases while I'm eating and chewing, but returns in its previous intensity after I'm finished. Is there a reason why this happens?
There is a direct connection between the gut and the brain. When you eat or breathe, it activates the vagus nerve. And we know that activating the vagus nerve takes pain away. So one of the reasons this could happen is that we even have vagus nerve stimulators that, or taking a deep breath. So basically what it probably does is activate, remember the direct connection between the gut and the vagus nerve and the brain. And that's probably what's happening.
Wow, that's interesting. So even, what about if you just decide to chew gum? Is that, does that count?
I'm not sure, but if you put gum in your mouth and has a flavor, I'm pretty sure it will connect to the brain.
Okay, that's very interesting. I learned something new. I didn't know that chewing stimulates the vagal
Actually,
nerve.
and that could
Yeah.
be tested, but you can actually look at cardiogram and the symbol, something called heart rate variation, and you can tell how much vagal activity there is and whether chewing will enhance it. And come to the office sometime. We're going to start doing some of that, Shirley. We can see if you chew gum, you'll get more vagal activity.
I would love that. I'll start chewing gum all the time if it helps my migraine attacks. Okay. Have you heard of people getting a migraine attack every time they eat, regardless of the type of food, quantity, or how prepared? What is the likely culprit and possible treatment?
Repeat that. What kind of food?
Okay. Any kind of food. Every time you eat, regardless of the type of food,
Got
quantity,
it.
or
Okay. All right. I become interested in neurogastroenterology. And what that really means is that it's what the food does to the gut. And basically, people sometimes when they have migraine, every time they stand up, they get tachycardia. And some people have these problems with their gut and funny bacteria. So I have been working with a neurogastroenterologist to help get to the bottom of this. And I think if that happens, you should have autonomic testing and look at gastric emptying to be sure that the nerves in your gut are working properly.
And if somebody wanted to go to a neurogastroenterologist, then you think they should probably go to their headache doctor first?
No, I think that if you're seeing a headache doctor and he suspects that it's a problem, then he should get you to a neurogastroenterologist.
Okay. Okay, great. Okay. How do the new CGRP medications affect the gut? In the 2 weeks following starting Ajovy, this person is saying that, and starting a steroid inhaler, she started having a migraine every time she eats.
Okay, let me try to make this as simple as possible. The way the gut moves, remember I talked about that intrinsic nervous system? That intrinsic nervous system, which makes the gut move, has a pathway that involves serotonin and CGRP. So when you block CGRP, you slow the gut down, and that can produce constipation. In fact, one of the common side effects of some of the antibodies is, in fact, constipation, because there is CGRP in the gut. And in fact, there is a patent out for using some of the CGRP antibodies to treat diarrhea.
Wow.
And last but not least, in the people who get infusions of CGRP to induce a migraine headache, they all get diarrhea.
Oh, that's interesting. Why would that happen?
Because CGRP results in gut motility. So it's
Hmm.
basically the chemical that induces the bowel to start moving.
That's very interesting. Okay, here's another question. I don't know if I quite understand it, but maybe you will. People with chronic migraine often try to live life as normally as possible, including engaging in exercise. If someone with migraine wants to run for several miles or more, believing it to be good for their headache condition and health, and believing that running in and of itself can slow gastric emptying action, which I didn't know that could be possible. How long would you say someone should treat a migraine with a triptan or NSAID prior to running?
The
I don't know.
easiest way to look at that is the following. How long does it take the triptan or the NSAID to get into the body from the gut? And I would suspect that you should take them at least an hour or two before the event, because it takes that long for the medicine to get in the gut. And that, in
Okay.
fact, there are certain people who get exercise-induced headache, and one of the treatments for that is actually giving a non-steroidal prior to the exercise. The other thing is to
Okay.
remain to be well hydrated. So if you run a lot and you're not well hydrated, it can cause a problem.
Okay. That's hydration is key for we know that, right?
Right.
Aside from frequent meals, is there anything you can do to prevent hunger-related migraine attacks? Doesn't that sound like a prodrome symptom, or is that actually, oh, I guess hunger related. If you don't
Yeah.
eat frequently enough, you can
Yeah.
have a migraine attack. Yeah.
If you feel hungry and you don't eat, it means one of two things. The hunger is giving the migraine attack, or the migraine is making you hungry. It's hard to tell, but that's
Right.
one of the reasons I strongly suggest you keep these bars in your pocket. If you're hungry, eat them. Or even
Absolutely.
or keep a Clark bar in your pocket.
No, not a Clark bar.
Yes, absolutely. Chocolate's the best thing.
Okay. Well, here's the next question for you, Dr. Silberstein. What's the connection between sugar and migraine? That's probably a controversial answer.
The way to look at it is the following. If you take a ton of sugar, your sugar level goes up, insulin's secreted and it drops, and dropping sugar is a trigger for migraine. And if you fast, one of the things that happens is your sugar levels go down. So that's probably the reason. It overloads the system.
Okay, so yeah, it's probably not a good thing to eat too much of. That's why I was curious about that Clark bar. Um, okay, can you elaborate more on why I should carry a chocolate bar with me to eat during a migraine attack?
Because there seems to be evidence. I say that halfway facetiously, but everybody thinks chocolate's going to be producing a migraine attack. But in fact, it's the desire to eat chocolate that's a premonitory symptom. And I just think that if you're walking around and you're hungry, you should have some type of nutrition, probably in this day and age, a protein bar.
Right, but you have to be careful. Those can have a lot of sugar too.
Yeah.
Okay, what are your recommendations on migraine diets? Oh, there's a couple of those out in the public eye these days.
As you look at it, the following, there's certain things that are part of diet that clearly can trigger migraine. MSG, lactose, etc. It's very rare that you can find somebody whose migraine is controlled by a diet. And it's really, I think, as I mentioned, it's the belief that something is causing your headache that can cause it. So in general, except don't get drunk, don't starve, avoid MSG. And if something obviously gives you a headache, don't take it. I don't personally believe in strict diets. Migraine patients have enough problems as it is.
Yeah, I've heard other doctors say that. Okay, so if probiotics are proven to assist, what do you suggest to improve gut health and therefore decrease migraine activity?
The problem is that we don't know yet. We know, for example, some types of bacterial infections, by doing a transplant of the right bacteria, you can help people. I think we need a lot of research on what food we need to eat to give us good health. We're just learning about these things. I mean, the fact that a certain species of bacteria can act and cut down inflammation in the gut, and another one can make it worse. So I don't know the answer to that question, but I'm going to keep my eyes and ears open to try to figure it out.
Yeah, I think we all want to know that. I think this question is a little bit related, but can you please talk about the potential benefits of changing the microbiome? Should we be looking for treatments that can change microbiome with the hope that it will help headache symptoms?
If you got the wrong bug, it can produce irritation. Remember that the microbiome can digest food for you. It can actually promote gut health. So the wrong bacteria, as I showed a little earlier, can do just the opposite. The problem is it's the beginning. And what we do not know is what's the right mixture of the right bacteria. One of the things I just found out, which is very interesting, is people in a common area through evolution, their gut microbiome evolved with the people. And as evolution proceeded, that species that had everybody, because from the mother to the child, would all have the same gut bacteria. And that's probably how we evolved as a species. I think what we really need to do is to look at people who have problems and don't have problems, look at the difference in the gut microbiome and see if we can get the right mixture for them.
Mm-hmm.
That will happen, but it doesn't exist now, except for people who need to fill.
Hopefully someone will start doing that research if it's not being started already, even if it's not related to headache. I mean, do you think it's happening already?
It is happening because there, as I said, that recent article, which I found, the fact that one type of bacteria calms the gut down and another bacteria doesn't, that's brand new information. So if we can find the right kind of bacteria to have people take, and it'll be a game changer.
Absolutely. Okay, so this is an interesting question. Since we know that artificial sweeteners you mentioned are problematic, then why is this an ingredient in some migraine medications such as Nurtec?
Don't know the answer to that question, but it's probably the fact that people eliminate sugar from their diet and only take artificial sweeteners, so the bacteria starve from sugar. So I'm not saying don't use them at all, but I think you should not use them 100% of the time.
Do you think that's the case also with stevia, which a lot of people have switched to?
With what?
Stevia?
I think that the lack of having natural sugars probably can cause a problem. And this is something brand new. I just heard about it.
Okay.
It's hot off the press. Let me say that.
Okay.
It's probably more important for diabetics because the lack of sugar in the gut interferes with glucose regulation.
Mm-hmm. Right. Okay. Okay. So could the GI side effects of the new CGRP antagonist medications actually trigger an increase in migraine attacks?
To the best of my knowledge, no. There is no evidence that I know of that the people who get constipation from the antibodies have more headaches.
Okay. Somebody, Sue, is asking, my migraine attacks feel better after I vomit. Why is that?
It's 100% true. And I don't know, it's true, but I don't know the exact answer. It may be related to the fact that when you vomit, you activate the vagus nerve. And activating the vagus nerve is anti-inflammatory and takes pain away. But I'm not 100% sure. And that's something I have to look into.
Okay, good.
It's a fact, but I don't know why.
Yeah, okay. Yeah, I've heard that's interesting too. So some foods that contain tyramine, the same foods that are restricted for someone on an MAOI can actually trigger migraine attacks. This would include red wine, aged meats, hard cheeses. Any comments on that?
I don't believe it.
Okay.
In controlled trials of food replacement, other double-blind conditions, most of the quote unquote food triggers don't trigger migraine, and they're more premonitory symptoms. There's an electronic diary study that's been looking at, and it turns out that most of the things that people believed were actually triggering the migraine turned to be features of the early part of the migraine attack.
Okay.
But that
So
doesn't mean that MSG, lactose, if you're lactose intolerant, starvation, getting drunk, those can trigger your migraine. But the common things that are believed to do it can only rarely do it.
And Christine's asking about MSG as a trigger for migraine attacks. I mean, I have, some
That's
people
absolutely
think it's
100% correct. And that's part
it's
of the Chinese restaurant syndrome, I think I mentioned.
Yeah, and that is not controversial because we
No.
know that studies have been done on MSG.
Yeah.
Sure.
Yeah.
Okay.
MSG, lactose, and some of the other things I mentioned. I just try to talk about things that I know really cause it.
Okay. Adrian is asking, do they understand the mechanism of how the vagus nerve affects migraine? And can diet affect the vagus nerve?
The way to look at it is the following. When you stimulate the vagus nerve, information goes to the gut and into the brain. And the vagus nerve has an effect of calming down the pain pathways. So, for example, if you stimulate the vagus nerve, like with a vagus nerve stimulator, you can take pain away from different parts of the body because it activates the brain pain control centers. That's probably one, because most of the information in the vagus nerve is going from the gut to the brain. When it's not the other way around, and therefore what the gut is doing is telling the brain, this is what's going on down here and we got to fix it. And that's why when people do deep breathing exercises, when you take a deep breath and hold it for a while and let it out, that activates the vagus nerve. It's a simple thing you can do.
Yeah, I talked about that for the Migraine World Summit about deep breathing and why people that can't exercise should consider that instead of starting with an exercise routine. Can your diet actually have an influence on the vagal nerve?
By definition, the vagus nerve monitors what's in your stomach and your gut. So if you get the wrong stuff in your gut, the vagus nerve is going to go crazy and tell the brain something's wrong.
So then why wouldn't a vagus nerve stimulator work for everyone?
Why wouldn't it?
Yeah.
It's like the way I look at it is the following. Nothing works for 100% of the people, which means to me that there are many parallel pathways in migraine, and that some people have one problem with one part and some people have another. So if you're vagally deficient, then a vagal nerve stimulator will help you.
Okay.
And one of the things we're going to we need to look at is we need to measure baseline vagal tone before we start the devices. And I suspect that people who are vagally deficient might respond better than people who are not.
How do you measure that?
By doing an EKG and looking the variation from one beat to the other. And that is a function of vagal activity.
So would that be something that headache specialists might consider doing, or would you refer out to cardiology? What would you do?
We're actually now looking at new devices and new procedures and getting very much involved because technology has gotten a lot cheaper. In fact, there's some watches in your hand that can be monitored to look at your heart rate variability. It's really a field that's opening up. And for example, we now know that people who have poor vagal tone measured by heart rate variability have a greater risk of dying of a heart attack. Okay. So that's new knowledge. So basically, if I suspect that if you have deficiency in vagal tone measured by the EKG, then perhaps giving more vagal activity, deep breathing, yoga, vagal nerve stimulator may help you.
Great, that's fascinating. Okay, Allie wants to know, how do you know if your stomach is not emptying completely? That's what I want to know too, Allie. I don't know. I think I have also the same situation.
Only way to know it is to either do a X-ray, or now you can have a radioactive little capsule that you can
Right.
actually swallow, and the gastroenterologist can follow it going through your gut. And that's probably the best way of doing it if you're not sure.
Okay. Somebody wants to know, Christine wants to know, would you be willing to share your slides? She wants to show them to her doctor.
I'd be happy to get some for her. Just tell her,
Okay.
just ask her which one she wants, and I'll be happy to send them.
Well, if you send them all to us, we can share them in a PDF.
Okay.
Yeah.
No problem.
Thank you. Let's see. Are vagus nerve stimulators getting close to being used as treatment for both migraine and neuro GI issues such as chronic nausea? Well, that's a good question.
We know that one of the treatments for gastroparesis is an implantable vagal nerve stimulator on the stomach. So the answer to that question is yes. The problem we have is that the vagal nerve stimulators that are used in the neck don't send information to the gut, they send information to the brain. So what I don't know if a vagal nerve stimulator would work to stimulate the gut to emptying, but I do know that there are vagal nerve implants on the stomach that make it move.
Huh, okay. Shelley says, sometimes I feel a headache coming on prior to having a bowel movement. Why?
Remember that the vagus nerve and the sympathetics are monitoring activity from your bowel and your gut. And if you start to get increased activity coming up through the vagus nerve, it could cause that. I mean, Rami Bernstein has clearly shown that the vagus nerve, which is parasympathetics, which become overactive, can actually trigger a migraine attack. So I believe that's maybe the explanation.
Okay. Somebody wants a similar question. A normal bowel movement is every 4 days for me. With a migraine attack, I have diarrhea. Is this gastroparesis and IBS issues?
Well, again, why people get nausea with migraine, independent of these comorbid issues, I don't think we understand 100%, but we know the direct relationship between migraine, bowel function, nausea, vomiting. And I think we're only beginning to understand this. We don't know the answers. There is a relationship, but we haven't figured it all out yet. I mean, basically, it's only in the last year or so that people have actually been able to put electrodes in the vagus nerve and measure vagal activity. I just found that paper in the last day or two. And what they can actually see is what's happening to the vagus nerve under different conditions. It's all cutting edge and happening now.
Right, okay. I've heard Dr. Bob Shapiro say that with the research that he's done with the gut-brain connection, that do you actually think that perhaps migraine, the cause of migraine, originates in the gut? What's your thought on that?
I think that there's a direct relationship between things that happen in the gut and things that happen in the brain. But I basically believe that migraine is primarily a disorder of the big brain, not the little brain. But they're interconnected. They're interconnected.
Right. Okay. Somebody wants to know, do you have any suggestions for books that can help with good gut health?
With good gut health.
Yeah.
I don't know, but that'll be a homework assignment, Shirley. We'll try to find some books for your people.
Okay, and if you find that out, we will send out an email to everyone with that information. So we can absolutely put that in our newsletter. So if you are not signed up for our newsletter, then I recommend after this meeting, you go to our website and register for our newsletter. Okay, somebody wants to know, so does migraine, gut, and constipation have direct correlation, and how do I fix that?
It's not uncommon for people with migraine to have diarrhea or constipation. And the question is going to be, Are they related or are they independent? And I think that if you do have constipation, there are things that a gastroenterologist or even some of the over-the-counter medicines can help you with. But I'm not a gastroenterologist, but what I would do is talk to my family doctor or to a GI doctor if it's a major issue.
Okay. Someone is saying that she was just diagnosed with Sibo, small intestinal bacterial overgrowth, and starting to take antibiotics to treat it. Do you think Sibo could be contributing to chronic migraine attacks?
I don't know the answer to that question. And the only way to get an answer to that question would be to look at people with chronic migraine and look at their bowel contents and see if more of them have that bacteria than they don't. That's the only way to know.
So that sounds like more research that needs to be done.
More research needs to be done.
Yeah, and I just want to pause and say the reason we don't have more research is because we need all to advocate. We need to stand up together and raise our voices and let the public understand that this is a disabling disease that it's not just a headache. We're all having issues with our gut. So it's something that we need to really stand up and have the public take notice. Okay, let's see. Oh, this is a good question. Carrie wants to know, is keto or intermittent fasting effective for blood sugar management to improve migraine? Can that improve migraine? I think you said that blood sugar management can.
Correct.
But yeah, what do you think? I mean, do you think the keto and the intermittent fasting is
outside my area of expertise? I know there's a lot of information there about keto diets and for lots of reasons, but I would have to look into that in greater depth before I give an honest answer.
Okay. Okay. And if you find anything out, we'll put that in our newsletter too.
Happy to do it.
Okay. Let's see. Any recommendations on electrolyte supplements to prevent migraine that don't have artificial sweeteners or too much sugar to trigger a migraine?
Why would you take an electrolyte supplement? The major problem we have is we don't have enough fluids, water or anything. And the time you take electrolyte supplements, to be very honest with you, is when somebody having a colonoscopy, they're getting diarrhea and you want to be sure you don't lose it. So I think you need to put it in context. If you're dehydrated, you need water. If you don't have enough minerals and salt, then you need to replace that too. But in general, use your judgment. I don't think we know. Just you have to be smart about these things and decide what does your body need. And if you have a lot of diarrhea, clearly you're going to need electrolyte substances. But if you're just running around or sweating, you just need water.
Right. Okay. Do you suggest any foods that we should eat to help with migraine?
Chocolate bars.
Okay. Well, I think everybody here would like to hear that as an excuse to eat more chocolate. Okay, let's see. Yeah, I think this is a question that somebody is asking about. Migraine can be triggered by tyramine containing foods. I think you probably said that's true, right?
It could be true. I would have to, a lot of these so-called triggers, I would have to spend some time looking at the quality of the studies and that. I know MSG, I presume tyramine could, but I won't take that as gospel.
Right, because we read that all the time, but then it's not backed up with research.
Yeah,
just like we read all the time, don't eat chocolate, that triggers a migraine attack, and now we know that it's not. It's a premonitory symptom.
I would have to do some research in tyramine.
Okay. Let's see. During my migraine pain phase, I am typically nauseous. However, I also have numerous bowel movements. It's like my digestive system is on overdrive at emptying everything. Well, any comments about that?
That again is the effect of the migraine. Now, if you think about it, if there's a lot of CGRP floating around in the body, just like those people got CGRP infusions, they got diarrhea. It's probably the same thing, overactive bowel and too much CGRP.
Right, okay. Uh, Katie Moran, who is a staff person here at Miles for Migraine. Hi, Katie, shout out to you. She wants to know, is dark chocolate better? Does it matter what type of chocolate you eat?
Some people claim from a dietary point of view that dark chocolate is better than milk chocolate. But from my point of view, I prefer milk chocolate.
Yeah, me too. Okay. Well, I think I can answer this question. Do you see migraine with POTS in patients? I mean, we think we know the answer to that is yes, right?
Yep.
Yeah. Okay. Yeah, that's a common not common. How common is POTS with people with migraine? My daughter
Okay.
has it. I have two
Okay.
daughters and one has POTS
Okay.
and I don't think the other does.
The way to look at it is the following. POTS is dramatically underdiagnosed. People have a significant postural component to their headache. When they get much worse, when they suddenly stand up or are lightheaded, should be investigated by looking at for the possibility of having POTS. And
Okay.
a lot of controversy. Some people in the pediatric world figure the way to treat it is through graduated exercise, and people in the adult world feel that perhaps medications might be better.
Okay.
And there's a couple different varieties of POTS, the so-called neurogenic POTS and other varieties of POTS. It gets complicated. That just tells you what kind of medication you should use to treat it.
Okay.
But I think POTS is underdiagnosed. And the other thing that
Underdiagnosed, yeah.
and also the other thing that looks just like POTS is a spinal fluid leak.
Oh, right. And you told me earlier today that what percentage of people could have a spinal fluid leak if they have chronic migraine or intractable migraine?
No, this up high. No, we did a study many years ago looking at people with chronic intractable migraine, and we found that about 30% of them had increased intracranial pressure.
30%, okay. Oh, someone's, Katie McDonald, who's our operations director, suggested stop sharing your screen so everyone can see you better. Thank you, Katie. Okay, let's see. Are there migraine preventive meds that can also be effective for chronic nausea?
A lot of the drugs we use for migraine to get the bowel moving, Dofran, for example, and sometimes drugs like prochlorperazine and compazine, which is a migraine rescue medicine, is also good for nausea. So there are a large number of new anti-nausea medicines that help with migraine.
But they can't be used as a preventive, right? Because I know.
No, you cannot use prochlorperazine or that class, whether you'll wind up with something called tardive dyskinesia. But you can use it on an emergency basis, whereas Zofran can be used more frequently.
So, I mean, but there's nothing on the market that's actually for prevention that can also be used for nausea preventively, you're saying, like, for example.
Not to the best of my knowledge, but there could be. And it depends. I mean, if you have a lot of nausea, one of the things you need to figure out is, do you have a lot of stomach acid? Should you take something that reduces that?
Okay.
Because a lot of people will have excess stomach acid and they're over-the-counter Pepsid or things like that that can take to reduce that and reduce the stomach irritation.
That's a good point. Okay. And also too many NSAIDs can cause stomach irritation, right?
Most common cause of stomach ulcers is too many NSAIDs.
Right. And a GI bleed would be the worst case scenario. And that could, well, anyway, that's what I heard on another lecture that we had. What about certain spices? Someone's asking, Deborah wants to know about jalapenos, turmeric, Old Bay. Can that trigger migraine?
I don't know.
We don't know, yeah. I guess no one's done that research. So again, which is why we need more advocacy. Let's see, somebody wants to know that she's been diagnosed with gastroparesis, autonomic dysfunction, and small fiber neuropathy. She's been experiencing debilitating migraine as well. What kinds of treatment should I discuss with my doctor?
that woman should see an autonomic specialist to coordinate care with a headache expert.
Okay.
And I have a couple
Uh,
patients exactly like that. And it's
uh-huh.
complicated and they need care of expertise in two fields.
Okay. Yeah, which is another problem that we face as migraine patients is comorbidities.
Because there's a lot of controversy and a lot of difficulty in treating POTS. And if it's an autonomic POTS, it's a little bit different than the other. And they need specialty care.
Right. Okay. With a history of vestibular migraine, can the gut cause the multiple symptoms associated with these types of migraine?
Vestibular migraine is an interesting disorder. Does that mean when you have a headache, you're dizzy or off balance? And the question to me is, which aspects of vestibular migraine are you talking about? Many people that get a migraine will feel dizzy. Some will actually have the room spin. And it just depends which part of the attack they're talking about. And I think there's a revolution occurring now in the appropriate approach to vestibular migraine.
Okay. Somebody's asking to clarify, do we want to change the microbiome? I guess it depends, right?
We're changing it every day we eat. I mean, the issue is not so much do we want to change it, but we don't know what we want to change it to yet.
Right.
That's the problem. When you take a probiotic, you're changing the microbiome, but we don't know what's in the probiotic. So that's the problem. The problem is we need to know what's a healthy bacteria in our gut. And if there is one for a certain person, maybe that's what they should be eating to repopulate
Right.
it.
Yeah. Okay. Here's a good question. Which nasal migraine medication should one investigate for migraine? Well, I think what they're saying, you know, it makes sense that probably all of our medications should be nasally inhaled, right? Or
Right.
maybe orally inhaled.
There are two triptans and there's two DHE preparations that, to the best of my knowledge, that are available as nasal sprays.
Right.
And
Okay.
one of the newer DHE preparation goes to the upper nasal pathway and has the best absorption.
Right. Right. Okay, and it works pretty quickly too. I know
Very
when
quickly.
I use a nasal, it works more quickly than when I use a pill.
That's
for
exactly
myself.
correct.
Yeah. Do people with migraine have gluten sensitivity? Well, that's a controversial one, right? I mean,
basically
people...
speaking, there are a number of people with migraine who've gone on gluten-free diets and they claim they get better, but there are no controlled trials.
Right.
My bias is, if you got migraine, you got enough troubles, why stop eating? And there's no question that there is a gluten sensitivity in some people, but people who have migraine try it. Some people claim it gets better. I don't know if it's
Right.
related to the fact they believe it or it really works.
Okay. What are your thoughts on caffeine? It seems to help my headaches, but seems to make IBS worse.
There's, you know, acetaminophen, Tylenol, aspirin, and caffeine is an over-the-counter remedy for migraine. And there's no question that caffeine can make IBS worse. So the way to get around that, you should probably have decaf coffee if you want to have it, or pick an alternative to the caffeine. But if it's hurting your gut, it doesn't make sense to try it.
Right. So if it seems to help your headaches, I think what you're saying, but it's making IBS worse, maybe that's not the best choice.
No, take an alternative.
Yeah. Okay. I think you already alluded to this, but Jonathan's asking, is there a psychosomatic aspect to migraine where the mind manifests trauma into migraine? I'm not quite sure I answer that, if I understand that, but maybe you understand it better.
Let's forget, is epilepsy psychosomatic? Somebody has electrical discharges in the brain and starts to see things? That's not psychosomatic. I think migraine is a disorder of the brain. We can image it, we can see it. And I think we tend to blame things on being psychosomatic when they really are primary brain disorders of the brain.
Yeah, that's like blaming the patient again, saying that, what did you do to cause it? You're
Yeah,
responding
exactly.
to trauma.
Yeah.
You should just go to a psychologist and get treated. But maybe that, um, the research that has shown that children who had traumatic childhoods, right, were more likely to have migraine. Maybe you want to talk.
There's no question that PTSD is a major cause of migraine. And in fact, we're actually looking now to do a grant for PTSD and post-traumatic migraine using a new device. There's absolutely no question. But that's because the brain has been damaged with head trauma. So
Right.
there's no question about that head trauma will make migraine worse. And the part of the symptoms are psychological ones after the impact.
Right. Okay. Why does migraine cause diarrhea? Do we know that?
Sure. If you believe that migraine is due to too much CGRP, if you give people CGRP infusion, you get diarrhea.
Right. Right. Okay. Let's see. Someone's asking, does migraine devices help to reduce migraine? And I would just say yes, for some people it does, right? I mean, we know that these devices work for some and some they don't.
Okay.
You had said that.
Yeah, we're actually now developing guidelines for devices. And it looks like with some of the devices, they work as good as the pills.
Oh, that's interesting. Okay, well, that's
We're,
good to know.
we're analyzing the data now, but everybody's different. So you have to use it correctly and get the right device for you.
Right, right. Somebody's asking, is deep breathing good? The answer is yes. It's always good to do that. Because, when we're in pain, right, don't we hold our breath also?
Yep.
It's like, yeah.
I think the secret is the following. Take a deep breath and wait a while and then slowly blow it out. The more you do that, the better that you get, more vagal activity you get.
Right. So you're stimulating the parasympathetic nervous system.
Right.
I mean, I know from being a yoga instructor, that's how I used to work with people.
Yep.
Right. So I have a breathing practice myself.
Yeah.
Okay. So let's say if you're sensitive to MSG, should you avoid all foods high in glutamate?
It's not glutamate, it's monosodium glutamate. It's a different animal. And,
okay, so
and glutamate is amino acid. You can't live without it. It's MSG. And you need to be careful because a lot of times they use a funny name for MSG and you can't tell from the label what it really is. So, but
they also natural flavorings is sometimes disodium glutamate can also be a substitute.
Yeah, exactly. But we should look into synonyms for MSG.
Right. Yeah, I know disodium glutamate. I was buying matzo meal last night and there was MSG in it. I was shocked. So, so none of that for the holidays. Are there any specific labs we could have ordered to assess our gut microbiome?
Not that I know of. It's such a new field. The only people working on it in industry now are people who are making, instead of doing a fecal transplant, they're just trying to create a more palpable or an easier way of taking bacteria from somebody who's normal and ingesting it as opposed to having a fecal transplant. And once that's done, and we don't know enough about the bacteria in the gut yet. And once we do, we'll know what to replace.
Right. We have to know first what they are. That makes sense. I don't know if you'll know the answer to this, but I know this is something that I practice in my yoga teacher training. Do you have thoughts on vagus nerve exercises such as humming, chanting, eye movement, meditation?
Talk to me tomorrow night. The reason being I'm spending tomorrow morning working with somebody who does exactly that. And we have data based on our heart rate variation. And I will know the answer to that because it's not even published yet. So give me a call tomorrow night, Shirley.
Okay, I will. I will put that in the newsletter as well. Yeah. Some of these questions we can put into the newsletter.
So we'll have answers tomorrow.
Yes. Okay, great. All right. Well, we have a lot of questions here, Dr. Silberstein. We're almost finished, but we might have to stop before we get through all the
Yeah.
questions because there are so many. Do you feel comfortable mentioning the name of the vagus nerve stimulators devices?
Yeah, this is, there
There's
are,
Gamma Core
Gamma
and,
Core is the name of the
and
company that makes it. And it's a device.
Nerivio. Oh,
No,
go
that's,
ahead.
no.
Yeah,
It's
that's a
it's
different one. I know.
okay.
Yeah.
A vagus nerve stimulator, it's about 1.5 minutes. You put it on each side of your neck. You can use it twice a day for prevention and as needed for acute treatment. Works for migraine and cluster. The Nervio device, another interesting device, it's a patch on your arm and it sort of tickles you. And by
Mhm.
doing that, it activates something called descending pain modulation. Give you an example. If you put your hand in cold water, your sensitivity to pain throughout your body decreases. This does the same thing without being uncomfortable. So that's the second device. There's
Mm.
another device which fits here, which is like a TENS unit. That's the third device. The newer device, which is not available, which stimulates front and back. I haven't seen it yet in the United States. It's made in Israel. So those are the, if I'm forgetting something, the major
Is
devices.
that Relivion? Is that the new
Yeah,
one you're
yeah,
referring to?
yeah,
Yeah,
but-
I tried it at American Headache Society last year.
Uh-huh.
So it's I think it's coming out soon, right?
Yeah, but I haven't seen
Yeah.
it yet. Yeah.
Okay. I can't believe I saw something before you. That's amazing.
Oh, I saw it, but I haven't seen it.
Just kidding.
No, I saw it in Israel when they were making it. The issue
Oh,
has,
okay.
no, what I'm saying is it's not available generally for people.
Yes, right. Okay. Do you know, Dr. Silberstein, what's a good heart rate variability number? Does it vary by age, sex, etc.?
Okay, here's the problem. I have spent 30 hours over the last 3 weeks trying to figure this out.
Mm.
I think I finally got to it. Now, if you took Fourier analysis in college and you can look at the distribution of frequencies, I can explain it to you.
Okay.
So there are two ways. There's basically a frequency domain and a time domain. And to the best of my knowledge, unless you have 10 hours, what I would suggest is the following. There's some good YouTube presentations where I've been learning them about heart rate variation. And some of them are very easy to understand. And basically speaking, what you wanted, there's different frequencies in the variation, and the high frequencies correlate to the ability to protect against heart disease. I'm beginning to learn about this, but the problem is that it's very, very complicated. So I would say the following: the high frequency heart rate variation, that having a lot of that is good, having little of that is bad. Now, if you want to ask me how do you define it, I'm gonna have to wait another month or two till I figure it all out.
Okay. All right. We'll come back. We can wait for that to put into the newsletter. Let's see. Kel, can any GI meds trigger migraine? Example, oh, well, you know how sometimes they say in the package insert that headache can be a side effect?
Headache is a side effect of every single drug. I'll tell you why. If you take a drug in a clinical trial and you got a headache, you just got drunk, it'll be a side effect. So,
it gets listed.
It gets listed. So
yeah,
I don't know of any drug that doesn't have a side effect of headache or nausea or blurry vision. But you have to, what you need to do is look at the drug and look at the placebo and see if there's any difference between the two.
Right. Okay. Let's see. What do you think the next place for research is for migraine and gut? Where do you hope researchers place their next efforts toward?
What I would like to see is people who with migraine, perhaps, maybe even identical twins, one of who has good migraine, one has bad migraine, and look if the difference is their gut flora and see what we can tell something about it. We don't know. I want to know, is there something about the gut flora in people that can protect them or make the migraine worse? It's never been done.
Right. And, hopefully this is why we need more research. This is, again,
Absolutely.
it's coming, but everything comes back to advocacy and reducing stigma of migraine. The only way we're going to get more research is to decrease the stigma. The only way to reduce the stigma is to learn how to advocate.
Correct.
So could the caffeine in chocolate be what helps or hurts?
My opinion, if you have a migraine attack and you take a chocolate bar and a cup of coffee, it'll make you feel better.
Yep. Okay. It'll certainly, the chocolate will make you happier. That's for sure.
Yeah.
Since there's no treatment for POTS, what's the advantage of getting that diagnosis?
There is treatment for POTS. First of all,
Salt, right? Isn't it like salt tablets?
No.
Oh.
POTS is kind of complicated. So what POTS means is when you stand up, your pulse goes out of balance. And that means you could pass out or faint or get a bad headache. So then you have to find out why your pulse comes up. Some people have so much noradrenaline going into their body that it's overtaxed. And that way you would give a beta blocker and it would control it. Neurogenic POTS means that you don't have enough norepinephrine. So therefore you give drugs that help control the body so that when you stand up, you get vasoconstriction, you get more blood going into the head and the brain. It's complicated because POTS is a series of different disorders with the same manifestation. And some people with POTS are totally bedridden, but they can't get out of bed.
Okay. Does that have anything to do with cranial pressure?
Okay. The biggest difference you need to figure out is that if a patient says they have a headache, that it only occurs when they stand up or after a while, you have to decide whether they have a spinal fluid leak or POTS. So the first thing you do is you put them, they check their pulse rate, lying and standing. And if that's abnormal, you approach that problem first. But if it's perfectly normal, then you would proceed with the fact they probably have a spinal fluid leak.
Okay. Okay, now you mentioned earlier about cranial pressure. Some people are underdiagnosed with spinal fluid leak. How would cranial pressure be measured?
If you have a spinal fluid leak, one of the easiest ways to diagnose is to do an MRI with contrast. And the entire lining of the brain lights up and the posterior part of the brain sort of goes into the spinal canal. And you also see blood vessels that the veins become expanded because the pressure is lost. So it's often you can make the diagnosis by doing an MRI.
Okay.
An MRV, yeah.
What type of doctor specializes in autonomic dysfunction?
There are cardiologists and some neurologists that are expertise in exactly that, where they actually measure these things and do and autonomic specialists. That is correct.
What's their training?
They do if they do after their basic training, they do a fellowship in autonomic.
Okay. Is there generally a shortage of this specialty?
Yes.
Okay. All right. Someone's is asking that she's been diagnosed with migraine and intracranial hypertension.
High or low?
Hyper.
Okay.
Pressure of cranial fluid. Can headaches be from both conditions?
If you have increased intracranial pressure, I would say that's the organic cause of your headache.
Okay. Let's see.
And the reason that's important is if it gets to your eyes, you can go blind.
Oh, wow. Okay. That's worth looking into then. Yep. Someone wants to know, how do you image a migraine?
Well, we can actually look at the different aspects of migraine by looking at MRI specific imaging, where we can look at how one part of the brain is connected to the other, or we can actually look at blood flow in the brain. There's a lot of things that we can do to actually image a migraine attack.
And that's typically used in research, the imaging?
That is, yeah, that is used in research. That is correct.
Okay. So somebody wants to know, can migraine trigger a fibromyalgia flare up, and can fibro flare trigger more migraine?
Fibromyalgia is comorbid with migraine,
Right.
which means if you have one, you're more likely to have the other. And pain begets pain. If you have fibromyalgia pain, you're going to get pain. It's going to make your migraine worse. Absolutely.
Yeah. And that's because the brain, right, is now hypersensitive and wants to
Exactly.
keep.
The more pain input to the brain, the more painful the brain feels.
Right. Okay. Let's see. What's the some of these questions I don't know if I could ask you. Would a fecal transplant help migraine? I don't think we know that, do we?
Well, the point is, it's not the fecal transplant, it's what you're transplanting. So what I'm really saying is, if you have C. difficile and you give normal stools and transplant them, people will get better. We don't know what the right feces is to give to a patient with migraine. We don't know what the bacteria content of the gut that's protective. That's what I was saying. We don't know the answer to that yet.
Which is why probiotics is controversial, because we don't know if they help or not, because we don't know what type we should be taking.
I'm not saying you shouldn't take it. I'm simply stating that if it doesn't work, it doesn't mean that probiotics don't work. It means that that particular probiotic is not the one for you. And we don't know yet.
Right. And we don't know because the research hasn't been done. Okay. Why and how does caffeine help migraine attacks? I think attacks, not migraine in general, because too much caffeine can actually cause
caffeine
more
withdrawal do it. How does caffeine work?
Is it a vasoconstrictor?
No, it's in the pain control system.
Oh, okay. Oh, I didn't know that.
Yeah, I think it's an adenosine antagonist, but I will have to get you the correct answer to that. Shirley, put it in there.
Okay, I will.
Because
about caffeine.
We never figured. It's only recently figured out how Tylenol works.
Really?
Yeah.
Wow. That's very interesting.
It works in the body's own marijuana system.
Oh, okay. You going to elaborate on that a little bit about the body's marijuana system?
It's complicated. I'll put it in your newsletter.
Okay. Okay, good. Let's see. All right, we have one more question here, and then we're going to stop for the night and let you go to sleep. Your brain's probably, well, you're good at this. You could talk about this all night. You mentioned 30% of people with intractable migraine have high CF pressure. How
Correct.
And where can we have it tested?
Okay. The way we did is by doing spinal taps with these people, found that the pressure was quite high. And then when we took off some of the spinal fluid, the pressure dropped and the headaches went away.
Okay. Wow. Well, I actually learned something. I learned a lot from you. I love having a conversation with you because you just can talk about anything, and it's so interesting. And I'm glad that some of the answers that you don't know, you're willing to say that. And we'll follow up, and I'll send you some of those questions, and we will follow up with some of those answers in our newsletter. And I just want to take another moment to thank our sponsor this evening, Impel Pharmaceuticals, and Dr. Silberstein. It's really an honor to be here with you here.
My pleasure to be here
and have you here. So we'll be sending out a survey and an email follow-up, which will also come with the recording. In case some of you logged in late, you'll see the recording. And thank you all for being here this evening. And good night.